So hello and welcome to Itentive Healthcare Solutions webinar. We're excited to present Gaining Efficiencies Using NextGen, Itentive Add-ons and Tools. My name is Chelsea Grover, and I'm the Marketing Communications Coordinator for Itentive. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. At the end, we'll send out a copy of the recording along with the slides of the recording within the next week. Next, for those of you who aren't familiar with Itentive, I wanted to share a bit of who we are with you. We specialize specifically in NextGen healthcare. We're good at getting data into, out of, around, and through NextGen. Basically, our goal in life is to make delighted clients by helping them get the absolute most out of their NextGen software investment. We're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen. Next, I wanted to mention an upcoming educational webinar that we'll be presenting next week on Wednesday. NextGen 5.9.2, 8.4.2, Favorite Features and Added Functionality. In that educational webinar, we'll be showing off some new features in the version of 5.9.2 and 8.4.2, along with an overview of the enhancements and tips and tricks we learned along the way. Our goal is to leave you with a comprehensive understanding of the benefits associated with the new version. I'll be sending out an invitation to that later today, so keep your eyes peeled, or of course, you can always register directly on our website. Okay, so back to today's presentation. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you may type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Tom Seco is Itentive's Business Development Manager and a subject matter expert on these products. And Joel Schultz is the Director of Product Solutions at Itentive, which means that he and his team are the people that actually built these great programs and thus is in a great position to demonstrate it. So Tom, I'm going to go ahead and pass the webinar off to you. Feel free to get started when you're ready.
Okay, thank you very much, Chelsea, and thank you everyone for joining us today to learn about more of Itentive's add-on tools and how you can use them to gain efficiencies using NextGen. So here's the products that we're going to cover today through our agenda. We're going to talk about our ChartGuard product and our ChartGuard OnDemand product. They're on the EHR side of NextGen. And then the next three that we'll talk about is RefundManager, the Unapplied Tool, and BillingManager. And those three are more on the financial EPM side of NextGen. So throughout today's webinar, you'll learn how these products work, and you'll learn how the products can increase efficiency at your practice, at your health center. However, before getting started, what I'd like to do is take a quick poll with you to get an idea of what's piqued your interest to join today's webinar, and that way we can get an idea of what more to focus on as we go through the webinar on these products.
So everybody, if you click onto your screen real quick, you'll see the polls up there, and if you'll just take a minute and answer what areas interest you the most, so we can focus more time and attention going over those products, that'd be great. You can see them up in your screen, and just helps us to give some insight into what we should cover. So we'll close this poll in about 10 seconds. So give that a minute, and we will be closing it in 5, 4, 3, 2, 2.5, or to be half. Anyways, 1, I'm going to go ahead and close the poll. Thank you guys for your answers.
Okay.
And it looks like here's what most of you are looking to see. So it looks like we got interest kind of all over the board. Specifically, it looks like in ChartGuard and in multiple encounters mode. And looks like all of them have some interest. So this will be a great presentation. Thank you all for your votes, and thanks for attending today. And Tom, I'll hand it back to you.
All right. Thank you very much, Chelsea. So the first product we're going to talk about today is our ChartGuard product, and it's our downtime solution. Simply, ChartGuard is a cost-effective, easy-to-use business continuity solution where it ensures, one, that you're prepared to handle a downtime situation at each of your office locations or health center locations, and then two, that you have access to your patient charts during AHR downtime. And through ChartGuard, at the high level, the way it works is it'll go out to your appointment book listing. It'll pull down the patients that are scheduled to come into a particular location. It'll pull that chart information for those patients, put it into a PDF file, and then send it out to a location where that patient is going to be seen. This is the information that you'll get in the chart, and I'm going to turn it over to Joe, and then Joe's going to take you through what the charts look like.
All right, great. Welcome everyone, and this is probably going to be the quickest part of the demonstrations we're going to do today, just because ChartGuard does so much of the work in the background overnight, so that in the morning, if you have an outage, you already have the charts at your site. ChartGuard we refer to as a high-tech, low-tech solution. Overnight is the high-tech piece that goes into your AHR database, looks at your upcoming appointments, creates PDF files where each one mimics the old paper charts we used to have, and pushes those out to the locations where the appointment is scheduled. So on top of your charts, you get an appointment listing that will show you who's coming in and when. This is useful because if you're printing the charts to paper, you know which ones you need to print and at what time, so you don't have to print the whole day's worth up front. You can just kind of get that going. This appointment list is customizable. We have clients that use things like the details field out of the appointment because that's relevant for the person coming in today. But let's jump into the meat of it, which are the patient charts that gets created. And let's look at one of those. So in the patient chart, we have the sections that Tom was just showing. It's a patient data sheet. It's your NextGen module data, documents, ICS images that you've scanned in. All those things become part of this PDF file, and you get one per patient that represents the chart. Now, we have some clients that always put these to paper when they're using them, and they simply flip through the paper and get to the various sections that they need. The amount of data in each section, we work with you to tune, because if the patient was here 10 years ago and the network's out today, you probably don't care about that visit 10 years ago. You probably care more about the visits over the last year or two. So again, we're not going out and having to pull everything into the chart so you get a ream of paper. We're more just pulling in the relevant data, and we work with you during the install to determine what that means. If you are using the charts electronically, because they're PDF files that are readable on pretty much any computing device out there, then we put in bookmarks too, so that you can easily jump to the various sections of the PDF to see the images and documents that are in there from your system. So each night, ChartGuard's going to look at your appointment schedule. It's going to generate these charts. It's going to push them out to the location, so they're there when the system is unavailable. And by the way, the most obvious system failure we see is network outages. So that's part of the reason it's architected to push the charts out to the location, and it does several days worth at a time and keeps a rolling window of those several days. So that in brief is ChartGuard, what it looks like, how it works, and I'll turn it back to Tom to kind of go into the next evolution of ChartGuard.
Okay, thank you, Joe. So what we're going to talk about now, the second ChartGuard product is ChartGuard OnDemand. Now, ChartGuard OnDemand is a derivative of ChartGuard, and it enables you to generate a chart basically in the moment. So if a patient comes to you and says, I would like to have my chart generated for me so I can take it to my next doctor appointment, you can generate the chart for that person within the next 15 minutes or so. We've created an interactive user interface that allows you to choose the patient for the patient information. And,
hey, Tom, can you share your screen, Tom?
Oh, sorry.
Thank you. Perfect. Thank you.
Okay. So, so you can generate the chart on demand for a particular patient. We've created a user interface that allows you to select the patient or a range of patients that allows you to do that. The uses for this is, like I mentioned earlier, a patient coming in and saying they would like to have their history, or you could also use it to share histories with co-managing providers. It also comes in handy when you want to, you have an audit request coming in from the outside and need to provide a group of patient chart information. So it's a good way to generate charts in the moment quickly, and allowing you to create complete history if you want to complete history, as opposed to ChartGuard, which was, as Joe mentioned, giving you maybe the past 1 year or 2 years. So I'm going to turn it over to Joe, and he's going to take you through a demonstration of ChartGuard OnDemand.
Okay, great. Thanks, Tom. ChartGuard OnDemand, as Tom mentioned, is really, we took ChartGuard and we took the input from our clients who were using ChartGuard, who said, hey, this would be a great tool if we could run it for a specific purpose. And Tom just listed several of those purposes. So we built a user interface in front of the ChartGuard engine that allows you to select either a single patient or populations of patients. So if Mr. Smith shows up at your practice and needs a copy of their chart, you can plug in their name, do a search just for that particular patient. If you have a particular provider who's leaving the practice and you want a simple way to quickly give them the clinical data on their patients to take with them, again, you can pick a provider and do a search by provider. Let's say maybe it's an insurance company audit or some other kind of audit. You can filter them by financial class. And we continue to grow the number of filters based on your input that are available in ChartGuard OnDemand. What I'm going to do here is pull up a list of population of test patients. And what we can do from this list is select any one of them or select all of them and tell it to go ahead and generate these charts. Okay, so what's going to happen is it's going to take this population, it's going to go off in the background, and it's going to produce those charts. Then you have a couple options. If you're just looking for several charts, you can pull them up right here from the user interface. So I can go into the history for these charts, find one that we've created, right mouse and do view, and this all gets logged in the database. Additionally, the charts generate to a folder. So if it is a large set of charts that you're giving to someone for some kind of audit or a provider who's leaving, whatever the scenario, those will land in a folder and you could put them on an encrypted drive and then hand them off to the other party. But these are the same charts that we're seeing in the ChartGuard earlier that we're using for the downtime, with a couple exceptions. One of them is, for these, we normally include a fuller patient history that we do for downtime, because if a provider's leaving, generally they want nearly the whole, if not the whole, patient history. If there's an audit, they want to go back further than you might need to during downtime. So these charts will contain more data than you would for the ChartGuard for the downtime solution. And again, it's a PDF. The bookmarks are in there so people can easily move around between the different sections and look at the data in the charts. So it's a nice, quick way to be able to pull clinical data out of your system for various purposes, whether that be for a single patient, a population of patients, a payer, so on. Tom, back to you.
Okay, thank you, Joe. So that's the two products on the EHR side of NextGen. Now we're going to start on the financial side of NextGen and the products that we have created to make things more efficient on that side of the practice. The first product we're going to talk about today is the RefundManager product. And RefundManager is the product that streamlines and automates the credit balance handling and refund check processing within a practice. We integrate with many accounting applications, so we eliminate data entry on the back end. On the front end, we do some streamlining, use technology to do some streamlining to make it much easier for individuals to find the credit balances on patient accounts and then decide what to do with those credit balances, whether to issue a refund or to apply that credit to an account that has an open balance on it. There are 3 modules that make up RefundManager, and when I get done, I'm going to turn it over to Joe, and Joe's going to take you through a demonstration of RefundManager. The 3 modules that he's going to cover in the demonstration is the Credit Scout module, and that's the module that enables you to find the credit balances on the patient accounts and then be able to take an action on those credit balances. The second module you'll see in the demonstration is the Batch Detective module, and that's the module that's going to move the refund information over into your accounting application. And then the Importer module is the third module that you'll see in the demonstration, and that is the one that moves the printed check information as far as the check number, check date, check amount, moves that over into NextGen and updates the patient chart with that information. So I'm going to turn it over to Joe, and Joe is going to take you through a quick demonstration of RefundManager.
This is the lightning round on RefundManager. We're going to go through a lot pretty quickly here. Now, this may bring out more questions for how RefundManager works, what it does, some of the nuances. Again, this is probably a great scenario for why we want to, in the future, do a one-on-one demonstration with your practice or medical group so that we can spend more time on a couple of these or one of these where you want that greater detail. But what I want to do today is give you kind of the cliff notes, the high level of how RefundManager works and where the productivity savings are. RefundManager, we integrate it in NextGen PM, so it's launchable from the add-ons menu. We set up the security so only people who need it have it. Not everyone gets it. You don't want everyone sending refunds out of your practice. It works with a number of different accounting systems. In our demonstration environment here, we're going to use QuickBooks, but again, there's about a dozen of them that we work with either directly or via file transfer, so we can move that information from NextGen to the accounting system and back. So as Tom mentioned, we're going to spend a few minutes in the Credit Scout. That's the NextGen facing component that's going to pull up the credits, and you can decide if you want to refund them, distribute them, move the money around, or task it out to the work log for research later. We're then going to come to the Batch Detective. We're going to take a batch of refunds, we're going to push them out to the accounting system, and then we're going to close the loop using the importer and bring the check information from those refunds back into NextGen and apply it to the transactions. So we use the term streamline and automate, the streamline being this first part where you still get to make the decisions about what's being done with your credit balances. However, once you do that, we're going to make it quick by doing the work for you to create those transactions in NextGen. Similar to what we saw with ChartGuard OnDemand, there's search criteria up at the top here. There's some filtering to help you qualify if something's a true refund or is it just a credit from over adjustments. So those filters can all be adjusted. And again, as part of the deeper demo or as part of the training, we can go with you into more detail on these filters. What I'm going to do is pull up a set of credits that are in our test database here and go through several of them, do some refunds, move some money around, and maybe task one out. So down at the bottom here, we'll start with this one for Jennifer. We have a credit on Jennifer of $122, and that's in the patient bucket. The insurance is nothing. And then it'll show us things like the oldest and newest data service, and then since RefundManager is multi-practice aware, it'll show you the practice or practices where this person is a guarantor and has an account. To see more information, we can click the little plus boxes here and expand down to see the encounters that have refunds. If I want to see more information about a particular encounter, I can click on that and I get a screen that shows me the same data on the transactions tab of the chart for that encounter. So you have that information here to see what's available. In addition to that, you have screens that mimic the financial summary and account summary. So we're giving you a lot of tools in RefundManager to be able to get those quick hits and get those credits either refunded or distributed, but get them handled. So let's say for the case of our demonstration today, we want to go ahead and refund these 3 encounters. In fact, we can go ahead and drill down deeper to the charge level. If we want to refund everything, we click the top refund checkbox and everything underneath it will be checked. If we only wanted to refund one of these encounters, we can just click the checkbox down here and the other ones won't. But for today, let's go ahead and refund these. So we've got at least 3 encounters we're going to do refunds for. I'm going to go ahead and pick another patient or 2 that we're going to cut refund transactions for. We're going to push those into the accounting system. And then I wanted to talk to you quickly about distributions. And distributions are when you have a credit in one spot and you want to move that to another spot where money is owed. It may be a charge within the same encounter, or it might be to a different encounter. So I've got a couple of patients here that are set up for distributions. Normally you'd qualify that using these filters, but for the sake of our demo today, we're just going to assume we know these are distributions and we want to move the money around. So for Oscar here, we can see there's a $295 credit. We can either let RefundManager do the distribution where it just walks forward oldest to newest, or if we want, we can go ahead and assign the credit to various debits ourselves. So the way we do that is over here, we pick the credit, and if there were several, they'd all show up here. And then we pick which debit we want to assign it to, which balance. So if we want to pay off all of the 236, we can do that. This one went to 0. This one still has a $59 credit. And if we want, we can go ahead and pay down the $67 down to about $8. Now, RefundManager is going to create these transactions down here for us. Everything to the left of the mouse is where it's coming from. Everything to the right of the mouse is where it's going to. Okay, again, let's pick one more of those. And let's say we're looking at one of these and we just can't decide if we're going to refund it, if we're going to distribute it. Maybe we want to have someone research it more later on. Well, that's a case where we'd pick the task checkbox. Once we've gone through this list and we've picked out which ones we want to do tasks, refunds, or distributions with, or nothing, we leave them blank, we can tell RefundManager to go ahead and do the heavy lifting for us. Go create all those transactions in NextGen. So we right mouse, process items. We've done some refunds before, so it saved our transaction codes. These are your NextGen transaction codes. We've done some distributions before where we've moved money around, so it saved the codes we last used for that. We haven't done a task yet, so I'm going to go ahead and pick a task here. And let's see what our options are. Credit balance on encounter looks good. All right, so now when we click start, it's going to go out there and do the work. So it's going to create 6 refund transactions for us. So instead of us just going in there, opening the encounters, adding transactions, entering the information, it went in there and did that for 6 of them for us in just a quick mouse click. It's going to create the task in the work log. So that's done, and it's going to do those moves, those distributions of the credits to where money's owed. And again, we're going to say yes. We get a summary screen. Again, everything to the left of the mouse is where it's coming from. Everything to the right is where it's going to. This is just a last review in case you've done a number of these. You can also save this out to Excel if you want to compare it later on, or save it for documentation that you did those moves. So we're going to go ahead and continue. And it just did that work for us. So those distributions were all completed. So now everything on the screen that's been done on our behalf through RefundManager has a strike-through line. But let's go over into NextGen and see what that looks like. What I'm going to do here is post our batch. And then we'll go into a few of these. All right, so here's our refunds that we did. Here's our transfers that we did, which were the distributions. So if we go into at the account level and look at one of these, let's take account 290. We can go to the account summary, and see here's where the work was done. Because it was a positive and negative of the same amount, the net was 0. But we can also see the individual transactions, right? Here's the encounters and here's the charges. We can go ahead and dive down into the encounter itself and see the transactions. So this was the one with the credit. So we took 59, sent it one direction, and 236, sent it the other direction. The system's going to put some notes in here so we know where it was taken from and where it was sent to. Additionally, it's going to create some encounter notes for you also. All right, so you have that documentation in NextGen for what you're doing. Let's take a look at one of the refunds, and then we'll go off and print our checks next. And again, similar to what we saw before, we have our transaction here that was just created. Right now in the transaction note, it just has the batch that that transaction's in. But when we pull back the check information, this will be replaced by the check number, check date, check amount without you having to retype all that. Additionally, just like before, we get an encounter note. We'll get another encounter note when we export it out to the accounting system. So we have that. So let's jump back into RefundManager and see how quick it is to send it to the accounting system. This will create the vendors and the payments in the accounting system for us. So we'll find our batch. I pre-created this batch. I have one that I keep reusing for these demonstrations. So let me do a broader search. We're going to pick our batch, and instead of us typing this all into the accounting system, we say export, and we send it off to the accounting system. Right now, it's creating the vendors and payments in the accounting system for us. It consolidated some of the checks down. So if someone had several refunds, it only sent one check over to the accounting system. So now we can go into our accounting system, which today is QuickBooks, but again, we support a number of different accounting systems. And here's a case where we took three refunds and broke it down into one check. So the accounting folks love this because, again, they're getting out of the data entry business. They review their batch. When they're good, they print their batch. Do your reprints from the accounting system still. But here now we have check numbers assigned to these. Well, we have a number of practices that prior to RefundManager used to put all this documentation back into NextGen by hand. But the great thing about RefundManager is you can do that with just a couple mouse clicks. So I'm going to go into the import. I'm going to find the batches that I've exported. I'm going to right mouse. I'm going to say, bring me those check numbers, import those in. There were 3 checks, but remember, we consolidated some. So behind those 3 checks were 6 transactions. So it went into NextGen and did that update. Real quick, what does that look like in NextGen? Well, I haven't refreshed the screen yet, so we're still seeing the transaction note from before. Let me jump off and jump back so it refreshes, and we'll see the check number, check date, check amount ends up in here automatically on your behalf. So all this work that RefundManager does for you, helping you streamline the process by once you decide what you're going to do with something, with that credit, it'll go ahead and create the transactions, the automatic push out to the accounting system, the automatic pull of the data from the accounting system back into NextGen. This is one of the biggest benefits of RefundManager, especially for practices that either do a high volume of refunds or just have one person doing a lower volume, but it's kind of a part-time job for them. The labor savings on this have been great for the practices who have continued to use that. We created this back in 2005, and the original clients we worked with back in 2005 when we created it are still using it. Tom, back to you.
Okay, thank you very much, Joe. So now that was the third of our products of the 5 that we've gone through, the first of our financial, and now we're moving on to the fourth of the 5, and that's the Unapplied Tool. The Unapplied Tool allows you to efficiently and effectively manage your unapplied balances in your system. It works at both the encounter level and the account level. And basically, a quick history about this product is over the past 10 years or so, we've been working with NextGen practices and health centers. And over those years, they've asked us to write scripts and small programs to address the unapplied balances on patient accounts. And what we've learned over those 10 years is that the amount of unapplied balances grows in terms of the number of instances and the overall dollar amount for various reasons from organization to organization. One of those reasons is the front desk may take a co-payment, and when the patient checks in, but the patient visit encounter hasn't been created yet, so the payment gets posted to the unapplied bucket and needs to be moved later, but in some cases it does not get applied later. So we've been able to write programs, as I mentioned, to address that, and the rules, the business rules from the various practices and health centers differs from organization to organization. So we took all of that information and put it into this Unapplied Tool program. And you can select any combination of those business rules. And I'm going to turn it over to Joe, and Joe's going to take you through a quick demonstration of what the Unapplied Tool looks like.
So if you think about RefundManager, which handles credits on the line items, the next question we got is, what do you do about the unapplieds? And that's where Unapplied Tool comes in. It's a complementary tool to RefundManager. You can use it with RefundManager. If you don't have a refund problem, but you have just an unapplied problem, you can use it standalone too. So similar to RefundManager, it launches out of your NextGen PM. It works directly with your NextGen database. As Tom mentioned, there's a number of different rules that are built into this, and you can pick which rules you do or don't want. There's a loop that goes through and handles your encounter unapplieds, and then there's another loop that goes through and handles your account unapplieds. For your encounter unapplieds, you can look for things like direct matches of the unapplied credit to the amount due. You can over apply, so you end up with a credit on the line item. And the great thing about that is then you can go to RefundManager because the credit's on the line item and issue a refund for that. So there's various options. We have some clients who kind of do a fuzzy logic on what should or shouldn't be a copay amount. So they've picked various numbers, right? Multiples of 5 and then 11, 22. And they put those into a screen where they can set up specific amounts. And then any remaining amount, we can do one of two things. We can leave it on the encounter, or we could move it up to the account. There's ways to scope all this down so that if you only want to do one location at a time or one provider at a time, they're unapplied, we can go ahead and do that. If you only want to work with certain SIM codes, you can do that too. For the account unapplieds, for your money that's up at the account level, well, that's about moving it down to the encounters, and there's options to go ahead and do that. Do you want to find a matching charge? Do you just want to work from the oldest to newest? Do you want it to consolidate on a single encounter so you keep kind of building up that balance so you can then refund it or do something else with it in the future? So all these are options to have here in the Unapplied Tool. For larger practices, you'd set the rules and hit save, and then it would run a job overnight that would create the batches, and then you'd come in the next morning, prune those batches, and post the rest of it. For our demonstration here, I'm first going to hit test and make sure that I'm going to get results. So that's a quick way where if you're picking rules to make sure that it's actually going to do something, you haven't picked rules that don't apply in your database. So in this case, I got 14 items here that it can move. And in this first box is just kind of a summary of which of these check boxes it belongs to, that particular action. But what we can do too is we can actually run it here, and it'll create the transactions in NextGen to move those around. So what we're seeing here with 2 of these for each one is that it's the transaction to move it from the unapplied to the line item, or from the encounter up to the account, so on and so forth. So these transactions just got created for us in NextGen. So if we come over here to NextGen, we can see here are our batches. and we can see the transactions that were created on your behalf. So if we go to one of these encounters, again, here's the transactions that'll move the money around. So you'd come in the next morning, review that batch, go ahead and post it. So the whole key here, and what makes this a little different, is the number of rules and variations that are available versus what's built into NextGen for direct matches. It's the culmination of years of writing unapplied scripts for different reasons why people got into unapplied trouble, and then taking that and putting a user interface on top of it so you could pick which ones apply to you. So again, the Unapplied Tool, it's a kind of a sister product to RefundManager, where RefundManager works with line item credits. This works with unapplied credits. All right, Tom.
Okay, thank you, Joe. So now we're going to cover the final product that we're covering today in our webinar, and that's the BillingManager. And BillingManager is a product that efficiently creates multiple encounters for a single patient visit. There are practices out there that have to create several encounters for a single patient visit. We've had requests from our clients and prospects that have this kind of situation and wanted a more efficient way to manage that. And we created BillingManager to address that. So I'm going to turn it over to Joe, and Joe's going to take you through a quick look at what BillingManager looks like.
So BillingManager is about getting the creation of several encounters, even across practices, onto a single screen. This is useful if you're in specialties where you have equipment that needs to bill under a different encounter. If you have a surgery center where you have a professional fee, a facility fee, an anesthesia fee that needs to bill under separate encounters, BillingManager gives you a way to do that from a single screen. And the way BillingManager works is you start from a base encounter. So we can either, there's a search screen, but if we know the base encounter, we can type that in and it'll pull that up. And typically that will be your professional charges. That's the one that's already created when the patient checked in. But additionally, we can create several other encounters. In fact, each of these categories we see here are definable. So as part of your configuration, we determine how many encounters you need to create, what's the default practice, what's the default location, do you want to pull the same insurance as the first encounter, the base encounter, to the other encounters? Great things like that. So it's really about, again, streamlining that work of creating encounters. So let's say we want to create an anesthesia encounter. We can right mouse, add new encounter. We can pick an existing one too, if some of them have been created already. And then we'll do anesthesia. We'll see it pull down some of the information and some of the defaults, like location was set as the default. The rendering from the main encounter was set to be the referring on the anesthesia encounter, so on and so forth. So we'll set a rendering here. We have a lookup. We can pull that back. We can set things like facility. All of the key fields that are in NextGen when you're creating an encounter are here. So then we can go ahead and add the charge. And we can pull that in here too. In fact, this is smart enough to do our anesthesia billing. So it'll calculate the time and number of units and extrapolate that out for your pricing. Of course, just like in NextGen, you can override that pricing too. So what we have now is we have our base encounter. We have a second encounter that we've created for the anesthesia. And let's say we want to create yet a third encounter. We'll set a rendering. If something's not set that's required, it'll come back with an error message. And we can go ahead and say, let's add a new charge here. I'm just going to pick a basic one here just to bring it back. So it's going to pull that information in. So we have our base encounter, and now we've put in the data to create 2 more encounters with charges in NextGen. So when we hit save, it's going to go out and put that information into NextGen for us. In fact, if we bring up this 1209 again, it's going to come up with these other encounters. All right, so if we want to go to one of the other practices and see what that looks like, so let's go to our surgery center and look at practice encounter 30. So here's our charge that we put in here, our patient information. We can bring forward insurances from the main encounter. So if the same insurances exist in the surgery center, you can have that populated. So a bunch of great options in here. And this is perfect if you're in that scenario where you're having to create several encounters for a single patient event. Okay, Tom.
Okay, thank you, Joe. So that is the webinar, the coverage of the 5 products that we said we were going to cover today to increase the efficiency and effectiveness of using NextGen. So we covered our ChartGuard product and our ChartGuard OnDemand product, both on the EHR side. ChartGuard was for the business continuity solution, downtime preparedness solution. The ChartGuard OnDemand solution was the one that enables you to generate a patient chart, basically in the moment. And then the 3 financial related products, the RefundManager product that streamlines and automates the credit balance handling, refund check processing, and then the Unapplied Tool that allows you to manage your unapplied balances, and then the BillingManager tool product that makes it much more efficient to enter in multiple encounters for a single office visit. If you'd like to learn more about each of those products individually, give me a call or send me an email, and we can schedule a more in-depth demonstration of each of the product that interests you. That way you can see the product in full swing, as well as be able to ask questions as they specifically pertain to your organization. So a little bit about us and who we are. As Chelsea mentioned at the beginning of the webinar, we were founded in 2003, and we have 20+ years experience with NextGen. We have 40-some employees in the company, most of which are consultants that travel from practice to practice, health center to health center, working with the organizations to get as much value out of NextGen as possible. If you take 2003 into 20 years, they do not add up, and the reason for that is Itentive started out as the IT department for a medical organization. And back in the late 90s and early 2000s, when the business mantra back then was focus on what you do best and outsource the rest, the medical organization was going to outsource the IT group. And the leaders of the IT group said, well, if you want to do that, what we'd like to do is form our own company and provide services back to you. So they agreed to do that. And from that point forward, we've worked with over 350 to 400 clients that use NextGen. And during this time frame, we've become a strategic partner with NextGen as well. We have an integrated solution model in how we provide our services to our clients. And we have consulting services where we will work with you to improve business process, improve workflows, improve reporting. That enables you to increase efficiencies, improve decision-making, things like that. We have a group of developers that can customize templates for NextGen. We have a group of developers that can develop productivity products and enhancements, like we talked about today. So all of the products that we talked about today get created through our products group. We have a group of IT folks that can manage your infrastructure and help from an infrastructure standpoint, both from a managed services perspective, meaning we can support your PCs, your desktops, your printers, your network connections. But we also have our own data centers, so we do hosting out of a data center as well. So if you wanted us to completely take over your IT support organization. We provide complete services to you through our hosting support organization. We can provide support of NextGen, and then we also sell. We're a NextGen partner and also an authorized reseller of NextGen, so we can do upgrades and support the NextGen environment. We provide any one of those services in a point solution or in any combination to provide an integrated solution as well. So as I mentioned, next steps moving forward. Here's our contact information, my information, Tom Seco, and then Joe's information with regards to our phone numbers and email address. If you would like to, as I mentioned, have a more in-depth demonstration of one product or multiple products, and get an opportunity to see what it looks like in full swing, as well as be able to ask questions as they pertain to your organization specifically, get in contact with us and we can schedule something for you. So with that, if there's any questions, we'll answer any questions for you.
Thank you, Tom. And again, if you have any questions, you can enter them in the questions area of the webinar control panel. It looks like we only have 2, so if you have questions, we'll have time to answer them. And I'll just go ahead and get started. This one is for RefundManager. Somebody's asking, does it run on a hosted or Citrix environment?
This is Joe. I'll jump in on that one. RefundManager runs where NextGen runs. So if you're running your NextGen practice management in a hosted environment, we can work with your hosting company to load RefundManager there. If you're running it on PCs, we can load it on PCs. Thick or thin client, either way, RefundManager can be loaded there. It's developed using a lot of the same tools that NextGen was developed in.
Great, thanks, Joe. Looks like possibly our last question. How often do you how often do you update ChartGuard to support new versions of NextGen?
ChartGuard is continuously updated. We have client requests coming in all the time asking us to do things. We keep it current with NextGen. So as NextGen has new releases, both of the product and of the KBM, we certify ChartGuard with that and make sure that we're continuing to pull the data that needs to be pulled.
Okay, great. Well, thank you, Joe. Thank you, Tom. And again, everybody for attending today. Thank you so much. It was a pleasure having you here. Hope to see you at next week's educational webinar. And try to stay safe out there in that icy weather, presuming that you are somewhere in icy weather, which seems to be a lot of the country right now. Thank you, guys. Have a great day.
Thank you, everyone.
All right. Thank you, everyone.